Speech language pathology. Speech language pathology or speech and language pathology is a field of expertise practiced by a clinician known as a speech language pathologist (SLP) or a speech and language therapist, both of whom may be known by the shortened description speech therapist. Speech language pathology is considered a related health profession or allied health profession along with the audiology, optometry, occupational therapy, rehabilitation, psychology, physical therapy, behavioral analysis, and others. SLPs specialize in the evaluation, diagnosis, and treatment of communication disorders, speech and language impairments, cognitive communication disorders, voice disorders, and swallowing disorders. SLPs also play an important role in the diagnosis and treatment of autism spectrum disorder, often in a team with pediatricians and psychologists. The profession. Speech language pathologists (SLPs) provide a wide range of services mainly on an individual basis, but also as support for individuals, families, support groups, and providing information for the general public. SLPs work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, voice fluency, and swallowing disorders. In children and adults, speech services begin with initial screening for communication and swallowing disorders and continue with assessment and diagnosis. Consultation for the provision of advice regarding management, intervention, and treatment, and providing counseling and other follow up services for these disorders. Services are provided in the following areas: cognitive aspects of communication, attention, memory, problem solving, executive functions, speech, phonation, articulation, fluency, resonance, and voice, including aeromechanical components of respiration, language, phonology, morphology, syntax, semantics, and pragmatic social aspects of communication, including comprehension and expression in oral, written, graphic, and manual modalities, language processing, pre-literacy and language-based literacy skills, phonological awareness, augmentative and alternative communication for individuals with severe language and communication impairments, swallowing or other upper aerodigestive functions such as infant feeding and aeromechanical events. Evaluation of esophageal function is for the purpose of referral to medical professionals. Voice, hoarseness, dysphonia, poor vocal volume, hypophonia, abnormal, rough, breathy, strained vocal quality. Research demonstrates voice therapy to be especially helpful with certain patient populations. Individuals with Parkinson's disease often develop voice issues as a result of their disease. Sensory awareness related to communication, swallowing, or other upper airdigestive functions. Speech, language, and swallowing disorders result from a variety of causes, such as stroke, brain injury, hearing loss, developmental delay, a cleft palate, cerebral palsy, or emotional issues. A common misconception is that speech language pathology is restricted to the treatment of articulation disorders, helping English speaking individuals enunciate the traditionally difficult R, and or the treatment of individuals who stutter, but in fact, speech language pathology is concerned with a broad scope of speech, language, literacy, swallowing, and voice issues involved in communication, some of which include word finding and other semantic issues, either as a result of a specific language impairment, SLI, such as a language delay, or as a secondary characteristic of a more general issue such as dementia, social communication, difficulties involving how people communicate or interact with others, pragmatics, language impairments, including difficulties creating sentences that are grammatical, syntax, and modifying word meaning, morphology, literacy impairments, reading and writing, related to the letter to sound relationship phonics, the word to meaning relationship semantics, and understanding the ideas presented in a text, reading comprehension, voice difficulties, such as a raspy voice, a voice that is too soft, or other voice difficulties, that negatively impact a person's social or professional performance. Cognitive impairments, attention, memory, executive function, to the extent that they interfere with communication, parent coaching, since so much of a child's language development happens at home. The components of speech production include phonation, producing sound, resonance, fluency, intonation, pitch variance, voice, including aeromechanical components of respiration, syntax, constructing sentences according to the grammatical rules of a target language, semantics, interpreting signs or symbols of communications such as words or signs to construct meaning, pragmatics, social aspects of communication. Primary pediatric speech and language disorders include receptive and expressive language disorders, speech sound disorders, childhood apraxia of speech, CAS, stuttering, and language based learning disabilities. Speech pathologists work with people of all ages. Swallowing disorders include difficulties in any system of the swallowing process, oral, pharyngeal, esophageal, as well as functional dysphagia, and feeding disorders. Swallowing disorders can occur at any age and can stem from multiple causes. Multidiscipline collaboration. SLPs collaborate with other healthcare professionals, often working as part of a multidisciplinary team. They can provide information and referrals to audiologists, physicians, dentists, nurses, nurse practitioners, occupational therapists, rehabilitation psychologists, dietitians, educators, behaviors, consultants, applied behavior analysis, and parents as dictated by the individual client's needs. For example, the treatment for patients with cleft lip and palate often requires multidisciplinary collaboration. Speech language pathologists can be very beneficial to help resolve speech problems associated with cleft lip and palate. Research has indicated that children who receive early language intervention are less likely to develop compensatory error patterns later in life. Although speech therapy outcomes are usually better when surgical treatment is performed earlier, another area of collaboration relates to auditory processing disorders, where SLPs can collaborate in assessments and provide intervention where there is evidence of speech, language, and or cognitive communication disorders. Working environments. SLPs work in a variety of clinical and educational settings. SLPs work in public and private hospitals, private practices, skilled nursing facilities, SNFs, long-term acute care, LTAC facilities, hospice, and home health care. SLPs may also work as part of the support structure in the education system, working in both public and private schools, colleges, and universities. Some SLPs also work in community health, providing services at prisons and young offenders institutions or providing expert testimony in applicable court cases. Following the American Speech Language Hearing Association's 2005 approval of the delivery of speech language services via video conference or telepractice, SLPs in the United States have begun to use this service model. Research. SLPs conduct research related to communication sciences and disorders, swallowing disorders, or other upper aerodigestive functions. Education and training. United States. In the United States, speech language pathology is a master's entry level professional degree field. Clinicians must hold a master's degree in communicative disorders, speech language pathology, MA, MS, MED, that is from a university that holds regional accreditation, and from a communication sciences and disorders program that is accredited by the American Speech Language Hearing Association, ASHA, the profession's national governing body, as well as individual state governing board. Programs that offer the MED degree are often housed within a university's College of Education, but offer the same education and training as programs with an MA or MS degree. Beyond the master's degree, some SLPs may choose to earn a clinical doctorate in speech language pathology, CSCD or CLPD, or a doctoral degree that has a research and or professional focus. PhD, EDD. All degrees must be from a university that holds regional accreditation, but only the master's degree is accredited by the ASHA. All clinicians are required to complete 400 clinical hours, 25 observation hours often completed during the undergraduate degree, and 375 hours of graduate clinical practicum. They must pass multiple comprehensive exams, also called knowledge and skills acquisition (CASA exams). After all the above requirements have been met during the SLP's path to earning the graduate degree, SLPs must state licensure and national certification by passing the National Speech Language Pathology Board examination praxis. Successfully complete a clinical fellowship year. CFY is a clinical fellow, CF, under the mentorship of a fully licensed mentor clinician. The CFY is no less than 36 weeks of full-time experience, totaling a minimum of 1,260 hours. During the CFY, the CF cannot earn CFY hours unless they work more than 5 hours in a week and cannot earn any CFY hours beyond 35 hours in a week. Receive American Speech Language Hearing Association, ASHA, Certificate of Clinical Competence, CCC, and full state licensure to practice, following successful completion of clinical fellowship. Year CFY. States are responsible for licensure of clinicians and other professional, and as far as the new SLP, these requirements are often similar to that of the CFY. Following the state licensure procedures and national certification requirements are usually done simultaneously. To maintain licensure, SLPs are required to participate in periodic earning of continuing educational units. CEU, Continuing Education and Training Obligation. Educate, supervise, and mentor future SLPs. Participate in continuing education. Educate and provide in service training to families, caregivers, and other professionals. Train, supervise, and manage speech language pathology assistants, SLPA, and other support personnel, educating and counseling individuals, families, co workers, educators, and other persons in the community regarding acceptance, adaptation, and decisions about communication and swallowing. Professional suffix, credentials of a clinical fellow typically read as MA, MS, or MED, CF, SLP, Jane Doe, MA, CF, SLP, credentials of a fully licensed SLP commonly read as MA, MS, or MED, CCC, SLP, Jane Doe, MA, CCC, SLP, indicating a practitioner's graduate degree and successful completion of the fellowship year board exams to obtain the three C's, the certification of clinical competence in speech language pathology. Continuing with part 2 later.